I am Dr. Rohit Adwal, consultant urology, andrology and robotic surgeon at Fortis Hospital, Mohali. And today we are going to demonstrate how this water vapor therapy works and the setup of water vapor therapy. This is the machine which is used to deliver water vapors, and this machine is connected with a handheld radio frequency device which delivers the water vapor into the prostate. So this contains some parts. Few parts are important. First is this contains a screen which shows what's happening and all the controls are there. Second is this place where sterile water chamber, focus on this, sterile water chamber where a syringe is inserted. We'll be demonstrating it later on. Third is this power cord where handheld radio frequency device is attached. Fourth, the line for saline from where irrigation is delivered while doing REZUM procedure. So this machine is charged by a power plug, 16 ampere power plug. The water vapor therapy uses sterile water to deliver the water vapors, but it uses saline for irrigation purposes. So first of all, how do we start? First we switch on the machine and then we select the saline, the amount of saline which is attached to the machine. We are using a 3-liter saline, so we will select 3000 ml. You can use 500 ml saline for irrigation, then you'll have to use 500 ml. This is very important because in this way the machine configures itself. Then we have to confirm it. After that, we'll have to attach all the leads. So this is handheld radio frequency device which is used to deliver the water vapors. My assistant has opened up its outer film. I'll show you how to take it out. First you'll have to revolve this, rotate this, and after this you'll have to peel the outer coverage. So this is how you take out the outer lid. So this is the power cord of handheld radio frequency device. It is connected to this area. We have to connect red dot with the white dot like this. So this is a sterile water vial which comes along with this packing, and this is the attachment. One has to fill this syringe with sterile water like this. We have to make sure there is no air. After this, we rotate it anti-clockwise and remove this plunger. This syringe is then attached inside this chamber like this. That's it. This pipe is connected, which is then further connected to this handheld radio frequency device. Next is we have to attach this line. We have to match purple with purple and green with green, and we have to fit this inside and click this like this. This click sounds signifies that this is okay, and this line is further connected to the saline. So there are 3 buttons of this radio frequency device: this white button, this gray button, and blue button. White button is used to deliver water. If you press white and gray together, you take out the needle. This is the needle retraction button, and this button is used to deliver water vapors, right? So there are 4 lines which are connected, which comes out of handheld this device. First is this power cord which is connected to a main machine. I have already demonstrated. Second is this saline which is connected with the 3-liter saline or 500 ml depending upon the operation theatre to theatre. Third is this white line which is connected with this water vapor chamber, and fourth is this outlet which is used to empty the bladder. Right? That's it. So after the circuit is complete, the screen will show like this. Focus here. So before the start of the procedure, we have to do the priming of machine and this delivery device. In this way, it checks whether this device is working properly or not. So how do we do it? We press white and gray button together. This will deliver the needle outside, and then we push this blue button. Focus on screen. This kind of display will come. It takes around 30 seconds for machine to get primed. In this way it checks whether all the ports and whether the delivery device is working or not. After the priming is complete, we have to again focus here. Retract this needle with this button and again push both these buttons together to deliver out the needle outside, and again this process is repeated by pressing blue button. Focus there. This will start a pre-treatment. This treatment is given before every patient. Now the device is ready to deliver the water vapor. Now you have to retract the needle.